Hello everyone, today we will be proposing a telehealth system for self-management of diabetes mellitus using smartphone and telehealth networks. My name is Nazifa Tasnim Ahmed and my partner is Nomi Farnaj.
First, we have to know what is diabetes mellitus. Diabetes mellitus is a chronic progressive metabolic disorder characterized by hyperglycemia, mainly due to absolute or relative deficiency of insulin hormone. The symptoms of diabetes is basically increased thirst, frequent urination, extreme hunger, unexpected weight loss, presence of ketones in urine, fatigue, irritability, blood pressure, slow healing source, frequent infections. There are 4 types of diabetes. Type 1 diabetes is thought to be caused by an autoimmune reaction that stops someone's body from making insulin. Approximately 5 to 10% of people who have diabetes are type 1 diabetes. Symptoms of type 1 diabetes often develop quickly. Patient need to take insulin every day to survive. In that type 2 diabetes, body does not use insulin well and can keep blood sugar at normal level. Most of the increased cases in type 2 diabetes because of our aging populations and rapidly rising numbers of overweight and obese people. Patient may not notice any symptoms, so it's important to get blood sugar tested if someone is at risk. Type 2 diabetes can be prevented or delayed with healthy lifestyle changes such as losing weight, eating healthy food, and being active. Here we can see the differences between type 1 and type 2 diabetes. In type 1 diabetes, pancreas fail to produce insulin, whereas in type 2 diabetes, cells fail to respond to insulin properly. There are another 2 kinds of diabetes, like gestational diabetes. In this, diabetes develops in pregnant women who have never had diabetes. This diabetes usually goes away after the baby is born and increase the risk for type 2 diabetes later in life. Baby is more likely to have obese as a child or teen and more likely to develop type 2 diabetes later in life too. Pre-diabetes blood sugar levels are higher than normal, but not high enough to be diagnosed as type 2 diabetes. Pre-diabetes raises patients' risk for type 2 diabetes, heart disease, and stroke. We have to understand the management of diabetes type 1. In management of diabetes type 1, insulin replacement is essential. Also includes monitoring glycemic control and controlling blood pressure and cholesterol. Optimal glycemic control requires self-monitoring glucose level multiple times daily and modifying insulin. Also, we have to maintain diet and physical activities. For type 2 management systems is often initially focused on lifestyle changes and may include the use of oral hypoglycemic medications. Sometimes type 2 diabetes patients use insulin in addition to or in place of medications to obtain optimal glycemic control. Glycemic control basically includes lifestyle, exercise, and medication. So to understand the problem in this case, we have to understand that people with diabetes only have contact with a healthcare professional for a few hours per year. The rest of the time they care for and manage their diabetes themselves. It is estimated that 95% of diabetes management is self-management. So self-management means people have to make these choices and decisions about how to manage their life and their diabetes. Good diabetes management have been shown to reduce the risk of developing complications, enhance quality of life, and reduce hospital admissions. So self-management is a condition of a patient living with long-term condition controls their condition and help themselves. So the key self-management activities associated with diabetes is diabetes education, eating healthy, monitoring and using patient-generated data to adjust behavior, preventing and detecting and treating acute and chronic complications, and coping with physiological issues and problem solving.
Objective of our project is developing a diabetes self-management smartphone app with features that include tracking blood glucose measurements, nutrition database and carbohydrate tracking, physical activity and weight tracking, sharing data with clinicians or peers, and social support messaging and reminders. Theoretically, the use of these features could help patients adhere to diet, exercise, and medication management plans, which could lead to improved diabetes-related outcomes.
Objective, we have to understand telemedicine and aim health. The basic principles of aim health interventions used for digital diabetes care and self-management depend on following tasks usually embedded into most of the current smart apps: mobile blood glucose self instruments and logging, improved diet and healthy eating, better physical exercise, medication adherence, enhanced education and awareness, insulin doses calculation, real-time feedback and information exchange between patient and doctors. From the picture, we can understand there is a patient end which consists of a smartphone equipped with a special database app connected wireless by Bluetooth to a blood glucose meter and used for tracking and sorting the patient's data. In the second part, we can see the acquired blood glucose data usually transmitted wirelessly via individual patient's smartphone and stored in a remote portal hosted hospital.
The primary features of the proposed app are the following. The first one being the medication reminder, where the app will send a notification for prescribed medication based on a pre-saved prescription on time. It will also help in blood glucose monitoring. The app will send a reminder to the patient for timely blood glucose measurement, and the patient will be able to maintain a log on the app. The app will also have a food database so that patients can just enter their meal and all the nutritional info will be automatically logged into their database. The app will have daily reminders for physical exercise, and it will have short video tutorials on how to do these things. And it will be able to connect to wearable fitness devices, and it will be able to import health and fitness data directly from those devices. Some secondary features of this app will include diabetes education, where articles and podcasts on diabetes education and self-management will be easily available. It will have a BMI calculator for easy BMI calculation and monitoring. Blood pressure and other health-related info can all be also monitored and logged onto this app. It will have a chat forum for social connection and support among patients going through the same journey. And finally, it will have a specific emergency alert system, which will alert the pre-identified emergency contacts at the press of a button if an emergency situation ensues. This is the proposed app interface. The patient will be able to do the things that we just talked about on this interface, like looking at the history of glucose and glucose level entry, and looking at the food chart for the past days. By talking about the benefits of the proposed app, the first thing that will need to be talked about is the improved quality of life. Having access to this app will mean fewer hospital visits and reduced stay. This will also lead to better symptom management, resulting in less pain, stress, and anxiety. It will improve the understanding of one's own condition and lead to greater independence, and overall, this will improve the quality of life. The emergency alert system will reduce the risk of critical and emergency situations aggravating or ending up fatal. Healthcare for diabetic patients will become faster and easily reachable with easier communication with healthcare provider. Another significant benefit of this project is the convenient and accurate transfer of data. Electronic data exchange eliminates the hazard of handling logbooks and manual data entry. Whereas smartphone apps can wirelessly transfer glucose readings from Bluetooth-enabled glucose meters, ensuring precise reading and timestamp. And finally, the accessibility of smartphones is a big benefit in this case. One primary reason is that smartphones are always within reach. Nearly every patient has a smartphone nearby at all times. In contrast, traditional diabetes devices such as glucose meters are frequently left behind during social gatherings and such. Beyond simply being more available and accessible than other diabetes tools, smartphones are also exponentially more powerful and have more advanced functionality than conventional diabetes tools, such as paper, logbooks, and such. This is our project roadmap. The first step will be the initial planning. After that, we will collect some relevant data and process them. Then we'll move to the system design and development phase. After the initial prototype will be developed, it will be tested and rectified, and finally there will be a primary release. After the release, we will have to work on marketing and maintenance. Then we will take feedback from the patients and refine our app accordingly. This is the budget breakdown of this proposed app. The total budget required for this app is 2,082,000 Bangladeshi taka. Thank you. If you have any questions, please feel free to ask.